we will be discussing the National Patient Safety Goals of preventing central line-associated bloodstream infections. Central line catheters are usually placed into a large vein with the catheter ending in or near the heart. They are essential venous access devices for many patients in the hospital as well as outpatient. Although they can be very helpful, central line catheters can pose serious complications if not handled properly. According to the World Health Organization, a total of 250,000 cases of bloodstream infections occur annually, and of those, about 62,000 deaths occur among patients in the hospitals. Central line-associated bloodstream infections are preventable if correct measures are taken. By using evidence-based practices and recommendations by the CDC, we can provide quality care, save lives, and save money. Join us now to learn more about how to appropriately utilize central lines and save lives. Some reasons why infection occur can be improper hand washing, a break in sterile technique, improper maintenance after insertion, contamination of the catheter hub, prolonged catheter use, the insertion site or catheter use, patient health status, such as immunocompromised patients, which are at higher risk for infection. To prevent central line bloodstream infections, it is important to follow your company's policies and procedures, along with guidelines of the CDC. The CDC checklist is an effective way to reduce the risk of infection and reminds the staff of critical key points such as proper insertion, maintenance, facilities, and some recommendations such as CHG baths and impregnated dressings or catheters. Another way to reduce bloodstream infections are the 4 E's: engage, educate, execute, and evaluate. This tool will help us identify the problem, figure out how to fix it, and evaluate its effectiveness. Now that we have a good understanding of what we do and why we do it, let's take a look on how it's done.
It's very important that you know where to locate your facility's policies and procedures and always follow them accurately when accessing or deaccessing or maintaining a central line. Here you can see the policies and procedures are characteristically defined. The most important part is to make sure that you've gathered all of your supplies before initiating the procedure. This will ensure reducing your risk for breaking sterile technique by not having your appropriate supplies. Utilizing chlorhexidine impregnated supplies, such as on the end of the caps, will ensure that you reduce the risk of contaminating the central line. Also, applying chlorhexidine impregnated biopatches on the PICC line will also ensure that you reduce your risk of spreading central line infections. The next important thing is to make sure that you've gathered all of your supplies before initiating any procedure. Making sure that you have all of your supplies gathered will ensure that when you do the technique, you will be less likely to break your sterile technique. towel is sterile, so you can't touch this towel. But I want you to pull your shirt down. And then keep your hand underneath my towel. I feel like I want to change my gloves for this part.
In conclusion, preventing central line associated infections not only saves money, but most importantly, saves lives.
By implementing evidence-based practices, we can offer quality health care, minimize lengthy hospital stays, and overall decrease the mortality rate.
We hope that you enjoyed watching our presentation and continue to use evidence-based practices to provide the highest quality patient care.